my name is Wes Anton. I work for Anthem Blue Cross. I cover 14 states. I'll go ahead and give you kind of a high level. The states that I'll start on the East Coast. The states that Anthem covers is starting what I would consider the East Coast. We've got Georgia, Virginia, New Hampshire, Connecticut, Maine, and New York. So I would kind of consider that on the East Coast. New York, we don't really advertise our plans to pay commissions. So, you know, you'd be limited mainly to Georgia, Virginia, New Hampshire, Connecticut, and Maine. And then what I consider our old central region would be the states of Indiana, Kentucky, Ohio, Missouri, and Wisconsin. And then also on the West Coast, we've got California, Colorado, Nevada. So those are the 14 markets that I manage and that, you know, we'll be talking about today. Good news going into this year's open enrollment, we did not lose any footprint. What I would say is we expanded in 5 of our states, those being California, Georgia, Indiana, Ohio, and Wisconsin. When I say expansion, what that means is we took last year's footprint and added additional counties in it. I'm going to have Steve pull up a resource here in a minute, and then I'll kind of simultaneously go through it and maybe, Steve, if I can show you and we can talk through. But Wisconsin looks to be a really good expansion state for this year. We're adding, you know, 50 plus counties to our footprint, which is really good. We had a very small footprint there last year, so excited about Wisconsin. Early feedback, I was just kind of as transparent as I can be. Early feedback in terms of competitiveness, as we look to be initially the rate balance that we're seeing, we look to be what I would say good in terms of competitiveness in Cali, Connecticut, Indiana, Kentucky, Maine, and Missouri. And Steve, so you know, like you said, you don't have to take notes. I'll send some of these highlights that I'm discussing. Looks like we're going to be taking what I would say it's going to be a tougher year in years past in Georgia and Virginia due to just tons of competition coming in. Seems like some people came in really low price. You know, I'm not here to talk about other carriers in a negative way. They do a great job. What we've seen is the new entrances coming really aggressively priced and, you know, maybe change the next year. So that's a strategy you'll want to think about if you, in terms of, you know, just knowing that going in. But what I'll do is maybe because I can't see, how about if, Steve, would you rather do a Q&A at the end or me pause? I know I'm talking a lot right now. However you would like to do it. I can just keep playing forward.
No, I think you can keep going. I'll monitor the questions that are posted. And if it's something that's urgent and I want to cut in, I'll let you know. Otherwise, we could save them for the end.
Okay. In terms of any feedback, am I talking too fast or can people hear me? Is what I'm saying?
We can hear you fine. By the way, one question came in. Are you, is New Mexico in your service area?
No, it is not.
Okay. Thank you.
Now, keep in mind, everything I'm talking about here is individual under 65 ACA. So in terms of Medicare, we may have some plans in some states that aren't these Anthem 14, but that wouldn't be what's being discussed today. So everything I'm talking about is Anthem under 65 individual product offerings. If you don't mind, I'm going to have you go to the same to this site with me. Keep in mind, everybody, this is a public site. You don't need any login. I would say 95% of the calls I get, I can go to the site and answer what I need right here. And it's anthembrokerhub.com. So just www.anthembrokerhub. Okay. So I'll just give you some advice on this site. They're making some adjustments right now for 23. This top part, when you get here, one thing to know, there's some what I would call quick links at the top, this individual OEP materials. That might be a good place to start. It's still kind of being fixed a little bit right now, so we're not going to do that, but just keep that part in mind. But the first thing I do is, Steve, if you don't mind, just scroll down to where you get to the filters on the left-hand side.
Okay, we're there.
And then under customer, you're always going to want to choose individual, if that's obviously the client we're looking at.
Mhm.
And then let's choose, just from where I'm from, let's choose the state of Georgia and uninclude Indiana.
We're there.
And then that's gonna open up to the right in the middle of the screen. You're gonna see these different, what I would say, resources. These things are all, you can do them, you can email them. There's really some great stuff here. Like I said, if you scroll up and down, I mean, there's some flyers you can give your clients in terms of, like I was talking about, $0 monthly plan premium, zero preventative. There's just a ton of resources here, state-specific network maps. But the first thing I want to go to is the third flyer where it says individual 23 family plans medical sales kit. Do you see that?
Is it the third tile on the right?
Yes, sir.
Yep. Okay.
Just keep in mind this Anthem Enhanced Choice, I'm trying to get that moved down. That's a short-term plan. I don't know why they have that in the first, considering we're all talking ACA. So I'm trying to get that moved, but just know you want your 23 individual family plans medical, the third choice. And if you click on the see all details, it'll open up a screen where you could email this to one of your teammates. You could email this to a client, put a message in there, but you can also view it on the left-hand side. There should be a blue view button, and you can click on that. Go ahead and click on that, Steve, if you don't mind.
Yep. And you've got the whole chart in there.
So what are you seeing right now? Are you seeing 23 individual and family plans?
Yeah, this is the plan benefit charts, HMO.
Okay. I didn't want you to go to that one. I'm sorry. That's the difficulty of.
Okay.
Let's see. Let's X out of this. So let's get back to the filters, and I apologize for this, Steve.
It's quite all right.
No, this is not easy. So you clicked on individual under customer, and then you click Georgia, correct?
That's right.
And then the third flyer to the right.
Well, the third one is, it says ways an Anthem USA can work for you. So that's stuck in there for Indiana. It's stuck in there for Georgia.
Yeah.
So,
so did you, I know what it is. Did you unclick Indiana and just
I did now.
Georgia click? Okay. There you go.
Okay. So now the third one is 2023 individual medical off exchange benefits chart. And then the next one would be 2023 on exchange.
I don't know. I'm trying to figure out why you're seeing different than me. The one I want, you've got individual clicked and just Georgia, correct?
That's
in
right.
Blue.
Right. Mm-hmm.
And nothing else. And then you've got, is the first one Anthem Enhanced Choice, consumer brochure.
First one's actually the sales kit.
Does it say 2023 individual and family plans medical sales kit?
That's right.
Okay, let's do that one. I don't know why it's showing in a different position than mine. I don't know. That's weird. Okay, let's open that one.
Okay.
And I'll send you this so you can send this out because this is the main one you need.
Super.
And then click on the view button.
Mm-hmm.
And then you should see 1 minute. It says 2023 individual and family plans on the marketplace.
That's right.
Okay. Click the right arrow. We're going to go through this document. It's about 11 or 12 pages, so it won't be painful, I promise.
Okay.
So you've got some information on the first talking about, plans and affordability, more member information, but you've also got a quick access to the benefit charts. What that would give you, if you click on that, it would give you the actual grid that shows you the different plans in your state. So whatever state it should be. See where it says learn more about marketplace plan benefits.
Yep.
If you click on that, it's going to take you literally to the benefit grid. And if you scroll down to about the 4th page, you can see from left to right all the bronze plans, silver, gold, and if you go down and it's going to give you your deductible, out of pocket, co-insurance, co-pays, your whole shooting match. I mean, we could spend an hour on this, but I mean, it's pretty much side-by-side comparison of the plans we got. So that's a quick way to look at, and that'll be for each state. So if you're working in Indiana, you would do the same thing, on the filter and just choose Indiana, and then you could go to this sales kit and then just click on learn more about marketplace benefits. I'm going to show you that. If you want, we can X out of there. There's a couple things that I utilize a lot.
Okay.
And then just go to hit the right arrow to the next. There's going to be a page, it should be on page 3, talking about HSA maximizing healthcare dollars. You see that?
Yep.
I don't get a ton of questions on that, but just know that's there. It also in here, it tells you, you know, a lot of things about resources, where to go if you need some more information. Page 4 talks about our pharmacy, $0 for most commonly used meds, 24 access to pharmacies, digital features. It talks about the level 1 and 2 pharmacies. You know, we've got the relationship with Genio RX home delivery, so you can get meds delivered to your house on 90-day supplies. So pretty much everything you need here in terms of pharmacy and dental and vision, all in one place. Keep going to the next. This is really important. I get this question all the time. I'll get on page 5.
That's right.
Finding care. What I've found is this is a hard thing. You go to Anthem, not a hard thing, but I get this question all the time. When you go to anthem.com, which I'll show you in a minute, this gives you the 8 steps to basically, I don't know if you guys have, I use it, I don't even know if I'm saying this right. It's kind of it's a screen grab technology where it just grabs a kind of a portion of the text. And what I'll do is wondering if your doctor's in network, and I'll grab those 9 steps and send them to my client. That works. And it'll tell you exactly where to go, what to do, the steps to find to make sure your doctor or hospital is in network. I get that question a lot. To continue on, the right side blue card, that talks about how, you know, you have access to emergent and urgent care out of your network as part of the Blue Cross organization. Going on to page 6, these are popular now. These are your member rewards. If your client, you can send them this. If your client goes to get their annual wellness or health assessment, they can get a gift card that's sent to them. And then keep going on page 7, talks about the Sydney Health app. I utilize this myself, and obviously proven by this morning. Technology is not my skill set, having issues with getting on the Zoom call, but the Sydney Health app is super nice in terms of, go ahead and if I was an agent and I enrolled a member, I'd go ahead and have them set this up if they are, using a smartphone. You can literally pull your ID card at any time. You can pull your claims, everything you need to know right there on your app. It's really pretty easy to use, and there's some information on that. And then really going to the end of this, page 8, 9, and 10 are more just kind of member information about Anthem, some things about COVID and what we do, so some stuff like that. But in my opinion, this is a really great resource that can answer, like I said, probably answers 90 to 95% of my questions. If you get, 10 minutes, if you don't mind, we won't do it now, but, as an agent, when you're on here, look at some of the other stuff. Steve, if you can X out of there and just go back to kind of the home page where you've got individual and Georgia chosen.
Mm-hmm.
And just kind of slowly scroll down. I don't know, I'm talking about, let's see, 1, 2, 3, 4 rows down. Like I said, you'll start seeing network maps. Some, 22 now is a great time to sell Anthem, some graphics about why you, want to sell us, things about HSAs, pharmacy brochures. I mean, there's just a ton of stuff in here. What I kind of tell people is it's a great site because everything's here. It can be a little intimidating because there's so much stuff here. So, utilize your filters on the left to try to cull it down as much as you can. Always choose individual in your state. So, like I said, this is anthembrokerhub.com. I would say this in your favorites. Check out the state you sell in and make sure, and if you have any questions or need anything, feel free to reach out. And I'll be glad to do an individual walkthrough, or I can do this for anybody, or small subsets, or whatever you need. This doesn't have to be a one and done deal, especially with not being able to share a screen. Obviously, everybody's time is limited with open enrollment and AEP coming up real close. Next thing I'll show you, if we're good here, is I want to go to our main site, Steve, which is anthem.com. Broker Hub, just our main Anthem website. If you can pull that up.
Yep, we're there.
I want to show a couple of things. Okay, so you see, when I showed you about where to go to, I'll show you a couple of things. On the right-hand side, there's a Find Care and a Login button. That login button is for members. So just know, if you're an agent, the Find Care is part of the instructions I showed you in that Anthem Broker Hub, how to find if your doctor's in network. That's where they're going to start. And that's right in the instructions. So you refer your members. So if I enrolled somebody in an Anthem plan, the first thing I would do is say, go to anthem.com, look at the first screen. Find Care is going to be if you find if your doctor's in network. And then I would have them go ahead and click on log in and register as a member. That way they can access their ID card and self-serve a bunch of things if they're at all technically savvy. So that login on the right is for a member. And if you click on it and they haven't set up yet, if you click on that, you'll see 4 members, and then they click for members. And if it says not signed up, register now. So that's what that is. But then I'll pause there, and I want to, if you can, Steve, back arrow. Sorry to make you bounce around. It'd be easier.
That's all right.
And then
go back to the beginning.
I want to go back. Yeah, and then everything you're going to do as an agent. Do you see the blue tabs across the top for employers, for producers, for providers, and then COVID-19?
Sure do.
Click on the down arrow next to for producers.
Right.
And this is where there's a news feature there, but I think the contact us is really beneficial. So if you can, click on that contact us button. And you should get a prompt to select your state. And if you select your state, let's just pick, let's do Indiana this time.
Okay.
So if you scroll down, what you're going to see is you're going to see on the left, individual broker services. You got a phone number and an email. You've got group. You've got Medicare on the right, small group, technical support, sales comp, licensing and credentialing. These are the best numbers. Unfortunately, what I've seen over my years is there's a lot of different contact numbers out there that get, released. I would always go here. And my recommendation, anytime you're calling for broker services, if you have an issue with a policy or a member and you need to call agent support, the individual broker services, I always do it first thing in the morning. These are the same numbers I use as an employee. What I've found is I usually start my day with, if I've got a service issue from the day before. I mean, if you have an urgent need, obviously you can call during the day, but I have a lot of success calling first thing because these things tend to go East Coast to West Coast. So, the call centers, as you get later in the day, it's longer wait times. But usually if I call first thing, I get through pretty quick. But I would always go here and utilize these numbers as your first line of defense to resolve issues. And then, you can also use email as well. What I would say is use these numbers first. If you don't get the support you need or you get an answer you don't like, my recommendation would always be to make sure you capture who you spoke with in broker support, when you spoke to them, and then escalate those to I'm assuming, Steve, you guys have kind of some escalated folks that they could take them to, and then you bring them directly to me.
Yep.
That helps. I think that's really, in my opinion, that's without, like I said, I had a deck I could have shared, but I was going to bounce around a lot. Let me just look at the deck real quick and just make sure I'm not missing anything. Then I'll probably just open it up. I went through the states. I talked about, let's see. I talked about the Sydney app.
What about the Broker Plus
new
app?
member? Broker Plus, yeah, great call out. So that's an app for you guys that you can check, your policies, your book of business, things of that nature. So I'll send you some information on, here it is. It's Producer Toolbox at the Go. So basically, it's an app where, you can track applications, receive timely messages, view your new sales, retention, commissions. Now, keep in mind, that would not be for the agency. That would just be for the agent specifically. and it's inside the producer toolbox. So when you register for your producer toolbox, when you get appointed, you should have gone and registered a portal for that. And I'll send you a slide of that, Steve, that'll help. Let's see. What about, are y'all comfortable? Do y'all need any high-level discussions with people? Have the other carriers been talking about Medicaid redetermination? We're calling it Medicaid renewal.
No, I don't think that's come up.
So I'll just high level. It's going to be a great opportunity next year. Basically, with the it's not done yet, but basically, as the public health emergency has been going, they have allowed people to stay on their Medicaid plans. As the public health emergency goes away, states are going to be at that point, you know, redetermining all these folks that have been on Medicaid plans. So, you know, the thoughts are there may be millions of people that are coming into the market that no longer qualify for Medicaid. So, you know, a certain percentage of those are going to go on a group plan. A certain percentage may, you know, go uninsured. Some will stay, but some, you know, I think the number is 15 million across the nation, or 14 million, and they think maybe 7 million in our area potentially will be looking for assistance. So that'll be a year-long opportunity after open enrollment for these folks to buy and purchase an individual plan. So I just wanted to share that as well after open enrollment. So hopefully, you know, as we get closer to that and as we finalize the dates when that's going to happen, you know, maybe we schedule a meeting or a quick call with hopefully the Zoom call. I got that figured out, and I can go through a little bit more detail on that, but I wanted to share that. And that's really, you know, like I said, I've got a bunch of slides where I can rah-rah about Anthem, and I love working here, and it's a great company. But I think you're more interested in, you know, what'll help you do your job day in and day out. So I'm open to take any questions or whatever else. You know, apologize again for the technical issues. And Steve, I don't know if you want to open it up now.
Yeah, sure. I see questions coming in. I'll read them as they come in. First one is, will you have an ACA plan in Florida anytime soon?
So at this point, the feedback I've received is that we are not looking. I haven't heard of any expansion states outside of our core 14 states that we're in now. And I'll be glad to go through those again if you think that would be helpful.
No, we'll have those posted along with any information you send us, along with the link to this.
Okay.
Plus, if I go back to let's go here, change state. So we can see all the states on the screen right now. Next question. Judy, I'll get some information back to you personally on that question. Wes, are you increasing the commissions you pay, and will you be paying commissions outside of open enrollment? Well, when it comes to commissions, that's something you'll want to talk to your direct manager about. But in terms of overall, are you going to have SCP commissions after the close of OEP?
Can I give, are you comfortable with me just kind of giving a high level strategy and no numbers?
Sure.
Steve, or, so what I would, good news on everything. I'm currently working on, well, first question, CMS came out with guidance that you have to pay the same commissions during open enrollment as you do during SEP. I don't know if you saw some of the other carriers last year kind of dropped commissions and then had to turn them back on. I didn't know if people were aware of that, but that's the reason.
Sure.
So it was some guidance that was kind of gray when ACA came on, that you couldn't compensate differently for different types of clients. And so that's where that came into play. So good news is you should see level commissions year round. So no more of this, you're paying this in open enrollment, nothing in SEP. It should be level year round. That's great news. Steve, for your feedback, it was, you know, running 14 states. I would say last year we had 13 different commission schedules for 14 states. For folks like you that probably work in smaller markets, that probably wasn't, you didn't know that, but that made my life not easy. I would say this year we were able to get the commissions much more aggressive and much more consistent across the states in terms of structure and things of that nature. So hopefully, I would say overall, better commissions, more stable, similar across different markets, and year round. So those, in my opinion, are all positives.
Excellent. There's a question here actually for HST. I'm going to do my best to answer the question. It's what website or platform is best to enter applications in order to get credited for it? And my understanding is you can either use Quote It or Coverage Builder directly, but you'll still need to enter the sale into Lead Masters for HST to track that for you.
Yeah, I know we're integrated with Quote It, so that's all I would know. But I don't know the other sites you're talking about, but I know we're good to go with Quote It. And,
Great. And another question here about Health Sherpa. Yes, you can use Health Sherpa. I've heard some questionable complaints about Health Sherpa in general, so I'm always a little leery, but I would say use it at your own risk.
The thing I would back on that is, we never, Anthem as a carrier, this is, I think sometimes people, I only get credit for a policy that's tied to you guys, if that makes sense. So if you submit a policy and it doesn't get tied to you as an agent, I don't get credit for it either. So my goal is always going to be to make sure you guys get credit. What I would say is keep a list if you can. I always recommend keeping a spreadsheet and then making sure your policies are showing up. If they're not, send them up through your commission teams and they can get them over to us and we'll research them and try to make sure you're assigned to the policy, if that makes sense.
Absolutely.
I mean, Anthem is in no way ever, we're not trying to get free policies. The brokers are probably not probably a huge portion of our business. We value the work you guys do and the support you give to the members that stay on our policies. So we want you assigned to the policies you write for the duration of the thing, if that makes sense. I didn't say that very well, but I hope the message.
No, that's a good point. So always make sure that your writing ID is included wherever you're submitting these applications, because otherwise you will not be the AOR and you don't want it to be chasing these down after the fact. Are there any other questions? Here comes one. This is more about commissions. Again, if you have any questions about your commissions, please check in with your manager or your upline. They're the ones with the details. Okay, well, I suppose that's all the questions we have for today. Wes, thanks so much for your time. I appreciate it. When you have the opportunity, just send me whatever slides you want to include with this, and we'll send that out with the link to the audio next week.
Okay, great. Now, like I said, I apologize to everybody for the technical issues, and just, appreciate the business and just know that I'm here to help any of you if I can, if you get in a jam. So appreciate the time today and good luck during open enrollment and the rest of the year.
Thanks so much, Wes.